Dean.
Thanks, Deputy Speaker. Well, Deputy Speaker, I'd be happy to take the member for Grey to my electorate to see the difference an Albanese government is already making after a decade of neglect from those opposite. And Deputy Speaker, I'm pleased to be able to rise today to lend my support to this important piece of private members' business. I commend the member for Griffith for bringing this matter forward, and I'd also like to congratulate her on her election to this place and her powerful first speech in the first sitting period. But Deputy Speaker, this motion goes to the heart of the agenda of the Albanese government in terms of access to and outcomes in healthcare. We recognise the essential importance of mental health in the overall context of public health. We also recognise that mental health services and supports can be inaccessible in terms of costs and availability and proximity. On this side of the House, we believe firmly that the only thing you should need to access important care is a small piece of green plastic, your Medicare card. A card those opposite have never been particularly committed to or interested in. And Deputy Speaker, recognising all this, our government is acting to put mental health at the heart of Medicare and ensuring that mental health services are located appropriately and accessible to all. At the recent election, we made a $1.1 billion commitment towards mental health. And what this looks like on the ground is 91 Medicare mental health centres across Australia. These centres are staffed by clinical and non-clinical staff who offer mental health support and care without the need for an appointment, referral or treatment plan. Best of all, it's free. All you need is your Medicare card. And I know how good these centres are, Deputy Speaker, as I have one such centre in my electorate of Bean. Last month, I visited the new Medicare Mental Health Centre in Tuggeranong with the Assistant Minister for Mental Health and Suicide Prevention, the member for Dobell, for its official opening. It was wonderful to meet the staff and partners who work to make the centre possible. The centre is a welcoming and calm environment with a dedicated and able staff ready to offer assistance. The location of the centre could not be better, being close to the Tuggeranong bus interchange, as well as parking and other public health facilities and shop fronts. The centre is located on Eileen Good Street in Greenway and is open from 9 a.m. to 5:30 p.m. Monday to Friday. I am pleased that my constituents are now able to access critical mental health supports and services for free, and that these services are close to other critical community amenities and transport links. Deputy Speaker, I'm proud to deliver this centre for the people of Bean. Deputy Speaker, our new Medicare Mental Health Centre will be complemented very soon by a number of other critical services in Bean, including a perinatal wellbeing centre, also accessible to anyone with a Medicare card. This follows on the establishment of an eating disorders clinic also in the electorate of Bean late last year. I'm looking forward to that perinatal wellbeing centre coming online soon, and also looking forward to the establishment of a Medicare urgent care clinic in Woden, just down the road from Tuggeranong. Deputy Speaker, I remain firmly committed to working to ensure that the people of Bean continue to get access to real, on-the-ground services which bring a meaningful and positive change to their lives and healthcare. I'm proud to be part of a government that is delivering meaningful healthcare and meaningful mental health care, not just for residents of Bean, but right across Australia. A government that has always made accessible and affordable healthcare a priority, from the beginnings of Medibank to Medicare and now to an Albanese government.